Hello, I'm Professor Kathy Sokol. I teach nursing clinical and in the classroom setting, and I'm going to present a short slide deck on nursing care plans and concept maps because I understand a lot of students have trouble understanding what they're supposed to do when they get these assignments. Let's talk about our agenda. What I'm going to present in these slides is assessment, nursing diagnosis, planning, interventions and actions, and evaluation. Let's talk about nursing assessment. Before you can develop a plan of care or concept map, you need to perform a complete assessment of your patient and their environment. Check vital signs. Perform a head-to-toe or a focused assessment. Assess any equipment attached to the patient. That could be IV pumps, oxygen tubing, Foley catheters, NG tubes, etc. And finally, we need to look at the patient's chart. Remember that the nursing diagnosis deals with how the patient responds to their medical problem. They and their body will tell you what's going on with them today. By checking to see if they have any devices attached to them, you can determine if this is something you need to focus on. For instance, an IV infusion means the nurse must plan to assess the IV site, the IV fluids, the rate the fluids are being administered, if the fluids are correct, if there's any reason the fluids shouldn't be given to this patient. A Foley catheter will indicate that the patient needs to have their output checked. We need to check the appearance of the urine, color and clarity, and the nurse will need to assess the perineum for redness or any sign of irritation from the Foley catheter. Assessing for signs and symptoms of a urinary tract infection are important. If the patient has oxygen attached to them, the nurse needs to make sure to check the oxygen saturation. It's important to assess the lung sounds and to see how the patient is breathing. Are they labored or unlabored? So you see, nursing assessment doesn't stop when you look over the patient's physical appearance. Finally, the nurse needs to assess the patient's chart for new lab results, diagnostic reports, new orders, especially for nursing care and medications, and the medication administration record. If the patient has abnormal electrolytes, for instance, does the provider know? The nurse may have to give them a call. If there are new medications, is anything discontinued? Are there any changes in the medication orders? If the patient is scheduled for any diagnostic procedure that requires a nursing prep, such as a colonoscopy, endoscopy, bronchoscopy, MRI, etc., is there a consent signed on the chart? Does the nurse need to keep the patient NPO? Is there any other prep needed? Enemas, removal of dentures, removal of metal piercings or jewelry, etc. Nurses use the NANDA International Diagnosis List to develop a care plan or concept map. This list is updated frequently, so the nurse must know what is acceptable for current practice. Students should refer to the latest version of the nursing diagnosis book recommended by their college curriculum. Remember, the nursing diagnosis is different from the medical one. You won't use the same terms providers use when you develop your nursing diagnosis. For instance, you wouldn't say the problem is cancer. You would select a problem that the cancer is causing. For instance, if the chemotherapy the patient is undergoing causes extreme fatigue, you can use the diagnosis of activity intolerance. Related to refers to what is causing the problem. If the diagnosis is fluid and electrolyte imbalance, inadequate, what caused the problem? Is the patient vomiting? Do they have diarrhea? That would be your related to. Finally, as evidenced by, tells you how you know the problem exists. Go back to the fluid and electrolyte imbalance problem. If the related to is vomiting, your as evidenced by is patient had 2 episodes of emesis measuring a total of 400 milliliters of green fluid this shift. Your AEB sets up your goal. I'll talk about that in the next slide. Planning. The goal is what you hope to achieve with your plan of care. Always use SMART options. S, specific, M, measurable, A, achievable, R, realistic, and T, timely. The reason you selected the diagnosis you chose is because you have an idea about how to address it. When you did your assessment, if you noticed the patient had trouble walking, you might have immediately thought altered mobility. So let's choose a goal for this patient. First of all, I'll write the nursing diagnosis. Altered mobility related to recent orthopedic surgery as evidenced by patient unsteady on feet when ambulating. The reason this patient has altered mobility is because he had a total knee replacement last week. A good goal for this patient would be, patient will ambulate using a walker at all times during the shift. Now you might be asking, why didn't you use risk to fall? I chose my diagnosis because risk to fall is too generic. Most hospitalized patients are at risk to fall, and for many different reasons. This diagnosis specifies the patient's problem and can nail it down to being caused by orthopedic surgery. There are other goals you might think of for the same diagnosis. Patient will ambulate with a steady gait by discharge, or patient will walk with assistance of one person while in hospital. Or patient and nurse will collaborate with physical therapy to perform daily strengthening exercises until discharge. You see, you can work your diagnosis many different ways to still achieve a good outcome. Think about each of these goals. If you did address any one of them, would the patient's problem be addressed? Sure it would. Finally, let's see if this goal is a SMART goal. Specific? Yes, we're talking about the patient and what he will do. Measurable? Yes, you can see the patient use his walker. Achievable? Absolutely. If the patient already demonstrated an unsteady gait during your assessment, he can use a walker. Realistic? Certainly. It's not unusual for an orthopedic surgical patient to use an assisted device until they regain independent mobility. Timely? Yes. We said the patient will use a walker at all times. That is our time frame. You could also have said that the patient will demonstrate correct use of a walker by the end of the shift. In that case, the time frame is by the end of the shift. Always make sure you have a time frame in your goal. It's the most common thing students miss when writing their goal statement. Interventions or actions are what you are going to do to make sure the patient reaches their SMART goal. They include assessment, teaching, performing skills, administering medications, consulting with providers, and reviewing test results. Don't confuse the terms nursing intervention and nursing action. They mean the same thing. Some textbooks use one or the other, and some use both. Either term means simply what you are going to do for your patient. This might be to perform an assessment, teach about a medication, insert a Foley catheter, medicate the patient for pain, call the provider or other healthcare professional and review the chart for lab results. Interventions, actions, are the tasks that nurses perform every shift. The interventions, actions, must be related to your diagnosis and your patient goal. I'll give you an example of an action that doesn't go with the diagnosis and goal. The nursing diagnosis is pain related to swelling of lower extremities as evidenced by patient states pain is 6 out of 10. The goal for this patient is patient will state pain level of 2 out of 10 or less 30 to 60 minutes after administration of prescribed pain medication. The first action, of course, should always be an assessment. This confirms that the patient still has the problem. Action 1. Assess level of pain, Q4 hours, NPRN. Here's where the student got confused. Action 2. Apply compression stockings to bilateral lower extremities. While this might be one way to reduce swelling in the patient's legs, it wasn't part of your goal which stated the patient would receive pain medication. If you wanted to add the action of applying compression stockings, you would have to state in your diagnosis, pain related to swelling of lower extremities as evidenced by patient has 3+ pitting edema of bilateral lower extremities. Your goal would be patient will have a decreased level of swelling from 3+ to 1+ within 24 hours. It's easy to get sidetracked if you don't pay attention to what you wrote for a nursing diagnosis. The correct way to address this diagnosis, which states the patient's pain level, is Action 1, assess pain level Q4 hours and PRN. Action 2, administer prescribed pain medication. Action 3, reassess level of pain 30 to 60 minutes after administration of medication. It's as simple as that. For every one of your goals, the plan, you will need to do an evaluation at the end of the time frame, usually the end of your shift. A goal can be met, partially met, or unmet. Let's do a patient goal of patient will eat 50% of all meals today. The goal would be met if the patient did eat 50% of all their meals today. It would be partially met if they ate between 25 and 50% of all meals today. It would be unmet if they didn't eat any of their meals today. In addition to stating if they met their goal, you would want to explain why. Goal met, patient ate 50% of all meals today. Goal partially met, patient ate 25 to 50% of all meals today. Goal unmet, patient ate none of their meals today. Finally, you want to say what you will do now that you have evaluated your plan. Goal met, patient ate 50% of all meals today, continue plan of care. You could also say discontinue plan of care if you feel you don't need to do anything further for this problem. If the goal is partially met or unmet, you might continue your plan of care if you feel you didn't have enough time for it to work, or you might DC the plan of care if you think it won't work. You might also choose to change the plan of care, tweak it a little, and make it more doable for the patient. Your instructor may require you to cite your responses on the care plan or concept map. Make sure you know what type of resource they want you to use. Some instructors prefer you stick to the textbooks you use in class. Others will accept academic publications not part of your required reading. If you don't know where to start looking for a resource, start with your main textbook. If that isn't what you need, try to Google it and then look for a college or university website for references. Your own college library is always a good resource. Most have access to CINAHL, which is a healthcare site full of both books and articles. Make sure you check to see if the one you use has been peer-reviewed and is current. Always use evidence-based practice resources. Use peer-reviewed resources. Write your citations correctly according to APA format. Beware of the internet. Not everything has been verified and tested. Cite as follows. Bryant, 2020, page 410. List the reference as follows. Bryant T., 2020, Textbook of Laboratory Tests, 2nd edition, St. Louis, Canyon Productions. I'd like to say a word about concept maps. What is a concept map? It's a way to link data together in a logical manner. It shows the relationship between concepts. It can link nursing diagnosis and nursing process. And it's a visual representation of linear documentation. Sometimes your instructor will ask you to submit a care plan in concept map format. It isn't my intention here to show you how to do this. There's a lot of information out there on the web that can explain concept maps much better than me. Some students find creating a concept map easier than a linear care plan. Some like the visualization it gives. If you're a spatial visual learner, you might find concept mapping to your liking. In any case, all the topics I presented here in these slides can be created in the form of a concept map. To sum it up, remember the steps to the nursing process. Make your plans simple, don't overthink it. Make sure your diagnosis goes with your plan and with your interventions. Don't forget to evaluate your plan. And keep up the good work. Thank you for listening to this presentation. Again, I'm Professor Kathy Sokol. My email address is there, and I have a blog spot down there at the bottom, a website you can go to for other information about adult learning. I welcome any correspondence and comments you may have to help me provide the information that you're looking for in the future. Have a great day.